Hello, my name is Christina. I'm a nutritional health coach and I upload delicious recipes, nutritional and lifestyle tips every week. In today's episode, I will be interviewing a dental hygienist who will answer the most frequently asked questions around mouth health. Nora Koller is based in Zurich, Switzerland. She is a dental hygienist and a mother of three. In 2016, she founded her own company called Biteaway, where you can find interdental brushes, and she runs her own show on YouTube called Biteaway TV. So Nora, welcome to my channel and my show. Thank you very much for being here.
Thanks for having me.
Pleasure. And I would like you to start telling us a little bit about your story, how you got into being a dental hygienist. I know that you're also a yoga teacher, so how that came about. So can you tell us a little bit your story, please?
Yeah, it started with the dental hygiene school. I started in 1997 and finished in summer 2000. And then I was working as a dental hygienist for years. And now, since today, there are almost 16 years already. I'm old. So, and I'm not a really quiet person, so yoga was very needed. And I finished my yoga teacher training in 2015. And meditation and yoga is like my daily bread and makes me much calmer, which my family appreciate a lot.
And how come you decided to become a yoga teacher? So you already had your job as a dental hygienist. So how did that come about?
Actually, I don't really teach at the moment yoga.
Mm-hmm.
It was more that I started the teacher training with the idea to know more about yoga. Going to a class was just not enough background information for me. Like just going to class twice or three times a week, I was hungry for more.
Okay.
And so that's why I decided to do it. I would love to do the 300 hours teacher training as well and go further, but at the moment time is a little bit tight. My time plan. So with the children as well, I can't do anything or everything. So
you need to prioritize.
Exactly. So maybe in a couple years I will do more of the teacher training, but for now I'm fine with that and go to classes again.
And do you think that it has helped you, yoga has helped you see things differently for your main profession?
Yeah, I can't compare myself to others because I don't know how they really work when they are alone with their patients. Mm-hmm. So I just see how they work when I see the patient like afterwards.
Yeah.
But I think it helps me a lot with the patients when I talk to them. I take my time before I start my treatment. And I always try to have in mind that everybody comes from a different place and have their own stories, and that the patient has not only 28 or 32 teeth and that's it. There's a whole body around. There's so much more. There's a soul with their own stories, and that's what I love the most with my job. After a couple years in the same dental office, to know my patient's story, like where they come from, where they want to go, how they feel in life. Are they mostly sad or are they happy persons? Whatever. I'm really curious about their lives as well and how they feel and on which point they are in their life. So we talk a lot before we start the treatment.
I see.
Yeah.
That's very interesting.
With the yoga background, it makes it easier also to listen to patients who don't like to have the fluoride or are not that into electric toothbrush or don't want to take medicine or whatever. It makes it for me easier than before yoga to hear it and say, okay, everybody's coming from a different point. They have their points of views, and yeah. tell them my side and hope to find each other in the middle.
I see. Okay, that makes sense actually. And
Yeah.
what most of your patients come for? What is the biggest issue in the mouth area? Usually, what do you see is the biggest problem?
The biggest problem usually is actually in the dental office I work right now. I have a lot of old patients, like they come in already since 10 or 20 or even more years.
Mm-hmm.
So they really know about their problems. But when I see a new patient, the most problem, or even when I talk to friends, it's always funny when I'm on a table and someone asks me, what are you doing in life? And I said, okay, I'm a mother and then I'm a dental. I said, oh my God, don't touch it. Okay, I don't talk to you anymore. And a lot of people still, even when we have really a good dental hygiene routine in Switzerland, a lot of people think that everything is fine. Like, I mean, most people have a small or a big gingivitis, and that's a painless course. So that's why nobody thinks they have a problem. And they mostly never bleed. If they brush their teeth, they don't bleed. But when they come in for a cleaning, they bleed.
Yeah.
Because of the inflammation.
Mm-hmm.
Gingivitis is a gum inflammation. And they always said, hey, I never bleed back home, but I'm always bleeding when I'm in the dental office, when you are doing this treatment.
Yeah.
So you are the problem. And that's not exactly correct, but because of the painless course, is sometimes so hard to explain that that the people have a problem. And mostly is gingivitis or periodontitis or cavities. It depends also on the diet.
So diet is the main cause of those three issues?
Of cavities. Yeah. Because that's a lot to do with a sugary diet.
Yeah.
You can eat sugar, no problem. You can have your soft drinks, whatever, but try to consume it with your main meals, like in the morning, for lunch or for dinner. And a lot of people who have troubles with cavities, they drink the whole day long soft drinks, sugary drinks.
Yeah, okay.
And then your pH level of your of the salvia is always on an acid level. And that makes it very easy for the bacteria to bite or to eat your teeth.
So when we consume something sweet with our meals, the pH is more balanced because we also have something that's less acidic, that is alkaline. Is that correct?
Yes, as well. But you have to imagine that when you drink, I don't know, a Coke or whatever, a sugary drink, it can be a coffee with sugar. That's a sugary drink as well. It can be a tea with sugar, sugary drink as well. It's not only like the soft drinks.
Yeah.
The body or the oral flora, like the salvia, needs an hour to get the pH level back on a normal level. An hour. So if you drink every hour, you don't get out of this acid level. And that's why when you consume it or drink it with the main meals, that's 3 times per day. And mostly after your breakfast, you clean your teeth. After dinner, you clean your teeth. Mostly.
Yeah, I see.
And so that's why that's the best point of the day to consume sugary stuff, even sweets like, I don't know, dessert or whatever.
I see. And you know this trend that now we have where people go crazy about whitening their teeth, and what is your opinion about it? What's your view on this?
When I see it here in Switzerland, we are pretty old school, I think. We have a lot of bleaching, but still not, if I compare it with the United States, almost everybody you see on Instagram or wherever they have like plain white teeth. And I think that's not really the same in Switzerland. But when I see all these Instagram accounts or Snapchat or whatever, where they make, where you see the whole whitening toothpaste or how you should do it, and there are some, they work pretty well, but I always see when they have the before and after picture, the teeth are whiter, no doubt, but the gingiva or the gums, they are sometimes so swollen and infected, like with an inflammation, that I say, hey, please clean your teeth first properly, or learn to clean them properly, and then whiten your teeth.
Okay. So what would be the most correct way? So what do you think these people that their teeth are whiter but their gum is inflamed, what do they do wrong?
Actually, mostly they don't know how to clean the proper way. They just use a toothbrush, maybe a mouthwash, because they maybe have a bad breath, and that's it. But almost everybody forgets or don't like to clean between their teeth, and I can hear them. But if you only clean with your toothbrush, you only clean two sides of your teeth, the inside and the inside and the outside, but you don't clean between. So you always miss two sides from four, and that's where the whole bacteria sit. And that's why you have bad breath, and that's why the gums will get swollen and will have an inflammation.
And we did say that traditional toothbrushes, they do not help you with that, and there are specific brushes that actually can go in between the teeth and can help you brush, right?
Exactly. You can go with floss. That's absolutely fine, but floss has there are little interdental brushes who clean way better than the floss can. The interdental brushes have 60% more cleaning effect than the floss.
I see.
But not everybody can clean with interdental brushes. Sometimes the gaps are so small that you have to combine the both.
Okay, and so going back to the teeth whitening subject, a lot of people use chemicals, which I know are sometimes can have too many chemicals that are harmful for our bodies. And do you recommend that we should avoid them, or use more natural way of whitening? Is there a natural way of whitening our teeth?
To be honest, I think it's a little bit like the same when you color your hair. If you make them blonde, you have to take almost the same chemical stuff you take for your teeth.
Okay,
So if you do it, I mean, it depends on how yellow your teeth are, your natural color, how dark or how bright they are already. So if you have normal white teeth and you just want to make them a little bit brighter, then mostly it's enough to do it once a year. And that's okay. Don't overdo it, but that's okay, just to do it once a year. But it depends. Some do it more, some do it less. It depends how you see the chemical stuff, how you want to consume it or not. But please don't use lemon juice and baking soda and mix this and brush your teeth like daily, or don't ever brush it with this. And I see on Pinterest, like almost daily, people who recommend this, and maybe it works. I never used it, but imagine baking soda. Just do it once with a silver spoon. Clean the silver spoon once with baking soda and lemon, and you will see scratches all over. And the same will happen with your teeth. You will have receding gums after using this after a year, and you will have wedge defective. So You won't see any difference like for the first month, but after a while, it's just the worst you can do for your teeth.
For your teeth, I see.
So then I prefer to go to the dentist, make a professional bleaching, and then do it with the chemicals.
I think we need to constantly talk to our hygienist and make sure that they recommend, because they know the best.
Exactly, that's always the best you can do. Ask your dental hygienist, ask your dentist, and he will tell you, listen, you have this and this problem, maybe don't do it. Maybe don't do it at all. If you have fillings in the front teeth, they don't whiten up. So if you start doing a bleaching, you need to do all the fillings to redo them. And that can be really expensive.
Yeah.
So there are a couple points you have to look at before you do a bleaching. And it's always hard for me because so many people ask me via Instagram or YouTube, how can I do a bleaching? How can I do a soft bleaching? It's so hard and so unprofessional to give an answer without seeing you in a dental office,
Yeah. So we mentioned that diet is the main cause for cavities.
Yeah.
Are there any other things that we need to be aware of that can harm our teeth? So I know sugar is the main one. I think last week you mentioned a few other things as well.
Yeah, I think because of my own experience, I think a healthy diet is overall a good thing to do for your whole body. And of course, it will affect your teeth and your gums if you only eat junk food. Even when you clean your teeth properly, then your problems may be not that big, but I think for the whole body, that wouldn't be a good idea to do. So, and it's always a little bit with fruit eating, fruit consuming, because of the acid in the fruits and teeth cleaning. That's a big no-go actually, because imagine when you eat or drink, what's pretty popular is drinking lemon water. So as well, if you drink it only in the morning, it's okay, don't drink it the whole day long. But when you drink or consume fruits and brush your teeth right afterwards, the acid softens the enamel, and when you start cleaning, you take the enamel off. So you get erosion.
Okay.
So normally we say, or we recommend, wait at least 30 minutes after consuming stuff like this, like fruits or acid stuff. And but in the morning, how you can do this? You won't brush your teeth before you consume your breakfast, right?
Yeah.
So that's a little bit hard to. Nobody gets up 2 hours before they leave the house, only because of teeth brushing routine, So it would be the better to take a mouthwash just to get the acid back up, the pH level, But that's sometimes not always so easy to do. It depends what you consume for breakfast. And of course, I love fruits. I could eat them the whole day long, but you need to be careful with toothbrushing afterwards.
Yeah. So I guess the recommendation here is just avoiding anything very sweet in the morning before brushing the teeth, if we don't have 30 minutes to wait. And so eating something more that is less sweet, basically like porridge maybe. And when we do have time, then that's fine.
It's not only the sweet, it's more the acid of the fruits.
I see.
It's more the acid of the fruits or for dairy products. So I have a lot of patients, yogis, and they consume every morning their lemon water, and that's the acid in the lemon water is really the hard stuff. So, and they told me, listen, I get up, I do my meditation, I do my yoga, whatever, then I consume my lemon water, and I don't brush at home. I just take a mouthwash for 60 seconds, And then I brush when as soon as I get in the office.
Yeah, and that can be done as well.
That's a good way to do.
Okay.
Exactly. It depends on your job if you can do it or not. But that's a possibility to have both, like your lemon water and a good daily dental routine.
I see. Okay.
So
what are the best practices then of making sure that we keep healthy teeth for as long as possible?
So the daily dental routine is pretty the same for everybody, and it's really not a big deal. I know it needs a little bit of persistence, especially when it comes to interdental cleaning. But it's always the 4 steps. Brush your teeth like 2 minutes in the morning and in the evening. Then brush between your teeth, floss or interdental brushes, or take both. Then clean your tongue with a tongue scraper. And in the evening, I would recommend a mouthwash with fluoride for 60 seconds, and that's it. Of course, have an eye on your diet, have an eye on your sweets, and have especially an eye on soft drinks or the sugar you consume with your coffee. Because a lot of patients always say, no, I never drink sugary drinks. I never consume any sugar the whole day long. I don't eat any sweets. And then we never find a solution why they have cavities. And then you ask them, do you consume or do you drink your coffee with sugar? Do you drink your tea with sugar? Oh, goodness. Yes, I do. But I only drink like 4 coffees. But is there sugar in? Yes. So sometimes they just forget that a coffee with sugar is also a sugary drink.
Yeah, it's considered sugar. Yeah, that's very true.
What's always a good thing to have is chewing gum. Of course, without sugar in it, just to bring your pH level back up. So if you have your coffee, if you can't drink your coffee without sugar, consume it. You can consume it with a straw, even better, and then just chew chewing gum. There are special chewing gums for teeth. You can find them almost everywhere now. So that's always a good idea to have in your pocket.
During a year, for example, how often should we visit our hygienist? What relationship we should have with our hygienist?
It depends on the problem you have. If you have like no tartar, no cavities, no gingivitis, once a year is completely fine. If you have gingivitis or stains, and I think I suggest to visit the dental hygienist twice a year. And if you have a periodontitis, like who needs more therapy, visit the dental hygienist every 3 months. So your dental hygienist will tell you exactly, or your dentist, how often it's best for you. But if you have no problem at all, once a year is absolutely fine.
Okay.
Yeah. But discuss that with your dentist or dental hygienist, and they will tell you.
So I think we've come to the end of the interview, Nora. Thank you so much. But before we go, would you tell us how we can contact you?
You can always find me on Instagram, like biteaway is my company's name, biteaway.com. You always can reach me at nora@biteaway.com. I answer ASAP, anytime, any question. I have on Facebook, at Biteaway on Facebook as well.
And you have a YouTube channel as well.
I have a YouTube channel as well, yeah. And unfortunately, I have not enough subscribers yet, so please subscribe. I'm By the Way TV, one word.
Yeah. So all this information will be in the description as well.
Okay, perfect. Thank you so much.
If you like this video, please give it a thumbs up. Comment on the section below with your thoughts. Share it with your friends, and do subscribe because I upload new content every week. See you in the next episode.